2003, in Europe generally, but much more specifically what's happened in France since 2003. So I'm here to share things that I've kind of noted so far. This is brand new material. This is the fresh stuff. You, on the one hand, are going to get a lot of unpolishedness here. On the other hand, it's a sneak peek. So, two sides of the same coin. I'm going to be drawing in the first part of the talk on two works that I published in the last 15 years or so. One on the left that I wrote with British and French colleagues in sociology, actually. That's about mortality reporting and how mortality reporting works in France, Britain, and the United States. And then the other is, of course, my monograph, Fatal Isolation, which is the story of kind of a social history of this extreme heat crisis in Paris, in particular, in August 2003. Okay, so I want to spend the first third, I think, talking, like kind of recapping what happened in 2003 and why it's so important. And then the new stuff will come toward the end. I'm going to go really fast through this. Like obviously I wrote a book on it, and so there's a lot to say, but if there's anything you want me to explain further, anything that you didn't quite get, please don't hesitate to stop me. So there are these successive and really unprecedented heat waves that strike Western and Central Europe in the summer of 2003. And they catch hospitals and public health officials and vulnerable populations completely off guard, leaving approximately 70,000 excess deaths in their wake. And I'll explain excess deaths in just a minute. So June and July bring heat waves that killed over 3,000 in France, 7,000 in Spain, and 9,000 in Italy. But these were just a prelude to what happens in August, when what's really the worst meteorological disaster in French history, I would say entirely. I'm going to give a caveat and say modern French history, because I'm sure that fire rained down from that in some immediate period or something I just don't know about. But it kills nearly 15,000 people in what looks like 3 weeks, but really these are concentrated from the 1st to the 14th of August. So about 15,000 people in just 2 weeks. In that same period, we see about 1,000 deaths in Paris. And then this political crisis unfolds, where essentially the nation is just kind of wringing its hands. There are repeated hearings in the National Assembly and the Senate, demanding to know how the nation, with what the WHO called the best public health system in the world in the year 2000, could see this happen just 3 years later. A couple of details I think are really important to share. So this is a graph that shows high and low temperatures by day, and then excess deaths per day. And you can see it very clearly that deaths trail these spiking temperatures by just a couple of days, and then they plummet as the heat diminishes. Right? So there's a very clear correlation here. One of the questions that I want to address, because it's the main topic of the talk, is what is excess mortality? So this is a term that we kind of batted about quite a bit with the COVID-19 pandemic, but I think it bears going into just a little bit of detail. So excess mortality is a metric that allows you to gauge the magnitude of a severe health crisis. There are a number of ways that you can calculate it, but the one that demographers and epidemiologists used in France in 2003 went as follows. It basically uses an average of daily deaths for July, August, and September from the years 2000 to 2002 as the point of reference. Okay, so you just average daily deaths in these summer months, right? In 2000 to 2002. And then you subtract the number of deaths, that number, from the number of deaths you observed daily in August 2003. It's really simple, right? Really straightforward. The result is excess mortality. Okay, so there are some upsides to this formula, right? It's really simple and robust. It's very straightforward, right? The math's a little bit more complicated than I explained, but that's basically what you're doing. It also allows you, so first of all, it doesn't require these really sophisticated population estimates, because you're going to assume that the population was relatively consistent in those 3 years, right? Unless you had a huge wave of immigration or something. But basically, you're counting on the numbers being pretty similar from year to year, without any major transitions. It also allows you to study mortality in August 2003 according to factors like age, sex, department. Okay, so France is divided into 72 departments, right? The US is divided into 50 states, right? With me? Okay. So where the people were living and dying, where they actually died. Did they die at home? Did they die on the street? Did they die in a nursing home? And all of these things are known factors for each of these years. Right? You know how many people died in hospitals on August 12th, 2001. Right? And so you can compare that to what happens later. Okay, but there are also some limitations. It assumes the relative stability of the population and death rates over time. And that's a fairly big assumption. It's actually much more consistent than you think. But it does make that assumption. Also, it's overly inclusive. So, for example, drownings and suicides climb significantly during heat waves. Okay? Drownings because people who are overheated jump in the water and they might not be able to swim so well. They normally wouldn't swim, but they're trying to cool off. So drownings go up, suicides go up because people essentially kind of lose it from the heat. So, you know, are those heat wave deaths? I guess indirectly they are, but they're certainly included in these figures. Right? And some might argue that they're only indirectly caused by the heat, so they shouldn't be. But in the absence of another major cause of death, so the absence of like a cholera epidemic or something, they wind up being a pretty good number to indicate just what the toll of the disaster was. So let's take a quick look at 2003 and look at who died. There are really critical disparities. Sex is one. More women died than men. Many more women died than men. Age. Older people fared far worse than younger people. Location. If you lived in a city, your chances were much worse than if you lived in a rural environment. And socioeconomic status. If you were poor, you were likely to die than if you were rich. Now, there are plenty of people who fall into one of these categories of risk who did just fine. Most people, actually, right? But when these categories, when these factors start to overlap, when they accumulate, then things get really dicey. So if you're a poor woman who lives in Paris and you're over 75 years old, your chances are terrible compared to if you're a young man living in like Keller or something and you've got some needs, right? And that, I think, points to the social rather than the natural basis of this disaster. Let's take a quick look at just how bad these age and sex disparities are. Here's men's excess mortality by age. And you can see that men who are 75 and older, sorry, this is in French, but I think you can probably figure it out, and I'll walk you through it. Men who are 75 and older, many more of them died than from 45 to 75, and basically it's flat for people who are under 45 years old. Now take a look at what happened with women. Well, not bad, right? I mean, women over 75 were at terrible, terrible risk. And they really bore the absolute brunt of mortality. This table, I think, gives us an even better look at what happened. So here's our 15,000 excess deaths down here. People over 75, you can see that 8,475 women died, 3,700 men died, so that's over 12,000. So of the 15,000, 80% are 75 and older, right? More than. So there's your total number of deaths, and there's your number of women over 75. Right? So older women bearing about 60% of the death toll, even though they're a relatively small part of the population. So why did this happen? Right? How come people died? One set of explanations is physiological. As we get older, our bodies don't regulate their temperature nearly as well as they do when we're young. And that's especially pronounced over the age of 75. Signal processing in your nervous system starts to break down. So messages of dehydration don't translate into thirst in your brain nearly as quickly as they do when you're younger. And the highest risk groups for these physiological factors are people over 75, as well as patients who are suffering from disorders like schizophrenia or Parkinson's, who are taking neuroleptic drugs. Those drugs produce the same physiological effects as aging does. But really, why did they die? I don't take physiology as the be-all, end-all. It's an important point that absolutely makes a difference. But I want to look quickly at some of these social factors. So one of the things, there's another group that's super vulnerable, that thermoregulates terribly and can't process dehydration messages. And that's newborn babies under the age of 1. Okay? So I just said over 12,000 people aged 75 and older died. I bet you can't remember from the table just a few slides ago, but how many newborns do you think
None?
Pretty close. 6. That's like a rounding error. That's an outbreak of bacterial meningitis on a single maternity ward. That's an anomalous year. It's a nothing number, right? So why do you think that is? Why did newborns not die, whereas older people with the same physiological limitations died like flies?
Probably being socialized a lot, held by people.
Correct, right? Babies,
Yeah.
by definition, cannot live on their own, right?
Right.
They are embedded in social networks where they die. And so, essentially, babies are cared for constantly, right? Their needs are constantly being met. That's why they're such a pain, right? I don't want a newborn again anytime soon. So what we see is as people age, they also tend to age into isolation. That independence that many people cherish, they want to live independently, can very easily become isolation as social networks begin to fray due to your friends and family dying, moving away, moving in with other relatives, and so on. There are also some important political factors. There has been historically, and I'm not going to go into detail or I'll never stop talking about anything else, or I won't have a chance to talk about anything else. There's politically been a real marginalization of seniors in French society since really the First World War, where essentially as the population starts aging considerably and becoming more and more female, I think as women outlive men, demographers and politicians begin blaming older women for sapping the vitality of the nation. That the nation has become old and weak and feminine as a function of this demographic shift. And that translates into really kind of direct discrimination against older women in particular. I have a whole chapter that goes into that. Yes?
So the fact that women tend to live longer than men, how does that affect the numbers of women who die?
Yep, I'll get into that. It's definitely a factor, but you can adjust for population and women still tend significantly worse. But that's, I think, my next slide, which sort of points at other things besides the sheer number of women. And then there are cultural factors, which I'll get to here as well. So let's just take a quick look at one or two measures of why women might have been at such significant risk. If you look at men who are 65 and older, about 2/3 of them are married. Women 65 and older, only 1/3 of them are married. When you get to 80, 2/3 of men are still married, but only 1 in 5 women is married. Also, there are about 50% more older women living in poverty than men. Okay? So remember when I said there's overlapping risk factors, right? Here you've got the intersection of age and poverty that disadvantages women, older women, significantly. Now I know marriage isn't a perfect overlap with living with someone else. I know, certainly there are married couples who live apart and there are unmarried people who live together, but it's pretty good, right? Most married people tend to live with someone else in their house. So what you see is that once you get to 65, and certainly once you get to 80, there are not just more women, but far more women living alone, living in isolation, right? And living in poverty. And that's enough to make the real difference. So yes, there are more women, but more important, there are more women who are living alone and poverty. Let's take a really quick look at geography. Oh, sorry, I meant to mention cultural stuff too. Okay, so when you have adult children and one of the parents dies, right? One of the adults' parents dies. If the mother dies, the adult children are far likelier to take the father in to live with them than they are to take the mother if she's the survivor. Any idea why?
Men can't cook.
Men can't cook, they don't know the washer from the dryer, they don't know what to buy at the store. Yeah, I mean, the mom has been taking care of the dad for 40 years, right? She'll do just fine on her own, whereas dad will be hopeless. Yeah. So that kind of stereotypes play into many more women living in isolation, right? As a function of gender ideology or ideas. Sorry. I want to take a quick look at geography before I move into what's happened since 2003. Okay, I don't expect you to look at all these numbers. I just want you to look at 2 of them. So France, I just said, is divided into 72 departments. It's also divided into 22 regions, which comprise multiple departments. It's confusing, I know. These are regions, okay? And here, so you've got your total 15,000 excess deaths. 5,000 of them are in just one region, right? A full third are in just one region. And that's a region called the Ile-de-France. Okay, so the Ile-de-France is Paris and its surrounding kind of urban, peri-urban periphery, okay? And so what you see is basically a full third of excess mortality is concentrated in just that one region, okay? Well, that makes sense. It's a big population center, right? Just like there are more women, it makes more sense that more of them are going to die, so that probably accounts for it. No. So if we look at the population of the Ile-de-France, it has a third of excess mortality, but only 18% of the population. So something else is going on. If you look at Paris itself, over 7% of excess mortality, but just under 3% of the total population. So something's going on, right? Something's happening here. Now, some of you in this room would probably explain this with reference to urban heat islands. Is there anybody who doesn't know what an urban heat island is? I mean, it's okay to not know. Really quickly, cities are hotter than surrounding green spaces, right, because of asphalt and glass and steel and cars and air conditioning units belching that hot air out, all these heat-producing sources and reflective surfaces, basically, right? So cities can be significantly hotter than surrounding areas. Okay, and you wouldn't be wrong to attribute this to an urban heat island. That's definitely going on. I don't want to deny that. But again, I think it's a little more complicated, just like it's not just physiology. I don't think it's just the heat island. There are really important social factors at play. Essentially, in the course of the book, I followed the trail of 100 people who died alone and were buried at public expense after the heat. And I tried to kind of recreate their social histories to try to figure out not only why they died alone, but also why they lived in such isolation as well. I was able to track down the addresses of nearly all of them and visited all of their buildings. And one of the things I discovered is virtually all of them lived in marginal housing. They lived in decrepit public housing projects. They lived in squats for unhoused people. They lived in terrible conditions. And indeed, they were spaces that were really marked by significant poverty, but also significant inequality. And I argue that one of these kinds of spaces, which I'll go into detail in just a second, demonstrates what I want to call a vertical geography of vulnerability. And that is people who lived in former servants' quarters. So of the 100 cases I tracked, about 40 lived on the upper floors of their buildings, the top story of their buildings. I want you to take a look at this one in particular. So I'm standing inside one of these people who died, standing inside their apartment. And I took this photograph of the courtyard. So I want you to note the zinc roof, okay? There's no insulation here. And so it's directly into this. The sun heats this building up. These apartments turn into an oven. These are 3 separate apartments. These aren't 3 windows in one apartment. Okay, they're the size of closets. They're tiny. They barely fit a bed and a dresser. They're about 90 square feet, typically. And this is kind of uniform throughout the city. This is a 19th century building style that carries well into the 20th century. They're former servants' quarters where your domestic help would live. When you live in an apartment, luxurious apartment on the floors below, your help would live up here. And they're typically occupied by older people who've aged in place, in real poverty. They don't have toilets, they don't have baths, they don't have showers. They're required by law to have access to a toilet in the same building, but not necessarily on the same floor. And many of them don't even have running water. So they are basically closets, like places to store the poor. Some of them are in really luxurious buildings. So this is one of the most exclusive neighborhoods in the city. It's just south of the Jardin de Luxembourg, which is almost like a Central Park in New York. You would compare this to like a Fifth Avenue or something in New York, right? A really very nice neighborhood in this turn-of-the-century building. And it's here that a man named Pedro Santamaria died on August 12th, 2003, in an attic apartment that was accessible only by a service staircase in the rear of the building. Okay? You go in the main building, you see the staircase going up, and the elevator, you have to go out into the courtyard, and then there's another staircase behind this kind of flimsy wooden door that goes up to the apartments where Pedro lived. I want you to note the exposed electrical box, the unfinished floors, right? This is a space of poverty in within a space of luxury. The space was completely open to the elements. The door wasn't shut at one end, the window wasn't shut at the other. It was teeming with pigeons and mice when I visited in 2007. Another case was an 80-year-old woman who lived within sight of the Arc de Triomphe and some of Paris's most luxurious department stores. She was named Paulette Moreau. She was 80 years old. Her body was found in her room on August 20th. She had been dead for probably a week already. And despite living with significant age-induced disability, she had to descend this tight staircase in order to access a toilet or her only water supply, which is this cold water tap on the floor of the well. So just imagine being 80 and having to go downstairs and haul up a bucket of water every time you need to wash yourself, wash anything. This is a daily humiliation in a lot of ways. And in conditions of extreme heat, it's just even worse, right? So essentially, these are just a couple of examples that show that these places are overheated traps for older Parisians. They're inescapable due to accessibility issues, and they have little means of cooling. So I spend the rest of the time just talking about what has happened since 2003. And I want to do this by addressing how extreme heat response has changed in France. So what do they do differently now that they realize, like, whoa, heat kills? What people have or haven't learned about heat risk. What's happened with extreme heat itself in an era of climate change. How climate change has affected how we measure death tolls. And how COVID-19 has thrown a kind of spanner into the works as well. Okay. So in 2004, France introduces, in response, of course, to 2003, what's called a plan canicule, or a heat emergency plan. And it's basically a regional alert system that's designed to ensure proper response. It entails close monitoring of temperatures by department through the summer with specific markers for alerts and interventions. There are activation plans for nursing homes, hospitals, first responders, volunteer networks, and things, right? It funded installation of air conditioning in nursing homes and the establishment of telephone safety networks. So if you think you're at risk, you can sign up with the city and you'll get a phone call twice a day once the temperature hits a certain threshold from a social worker who'll just check on your well-being. If you don't pick up the phone, they'll come to your apartment and make sure you're okay. So it's a nice idea. There have also been really important initiatives for green building and new infrastructure, like cycling infrastructure, alternative transportation. Any new building that goes up in France, in the whole country now, needs to have either a green roof or solar panels on the roof. So that's kind of a step in the right direction. But there are real limitations to this plan. Alerts don't reach the most vulnerable. So you can shout through the media and internet all you want, but it's not going to reach somebody who doesn't have an internet connection or a television. So whether that's somebody who's older and living in poverty and simply doesn't have access to those resources, or somebody who's unhoused. So some of the most vulnerable people are simply not getting the news. Air conditioning in nursing homes is great, but it doesn't help people who are living in isolation on their own. Right? And people in nursing homes, actually, for the same reason that newborns did well, people in nursing homes actually fared pretty well. They were already some of the most fragile, but they were also being cared for. And so only about a third, I say only about a third, 5,000 people, but only about a third of those who died were people who were living in nursing homes, which is, it makes sense because they're being cared for, but it also stands out because these are people who are the most vulnerable in lots of ways. But many of them were on IV drips, so they need to be hydrated. There are real disincentives for voluntarily registering with these telephone networks. If you think about it, right, we've already identified the typical heat wave victim as somebody who is older, who maybe has some comorbidities, they're not very healthy, they are living in poverty. And I don't think anybody wants to think of themselves as being in that position. And so relatively few people have actually signed up for these. I'll give you the exact numbers in just a minute. And infrastructure is great, but it's a long-term project. Right? It's not going to, it has delayed effects. It's not going to change things overnight. It's critical for the future, but in the next decade, we're not going to see the results. So what have people learned or forgotten about heat risk? So there's a 2019 paper from Karine Laïdi, who's at Santé Publique France, basically the Ministry of Health. And her team noted that only 12% of French people see themselves as vulnerable to extreme heat, even though 40% claim that they suffered from a terrible heat wave in 2015. So that's kind of an interesting dynamic there. If you get over 65, only 4% of people see themselves as extremely vulnerable versus 2% of people that are 18 to 65. A couple of other figures that jump out of this piece that I think are really fascinating are the perceptions of who are the populations at risk. So 90% of French people, unsurprisingly, see older people as at risk. So that makes sense, right? The whole kind of framing of what happened, this makes perfect sense. 2/3 of people see babies under 2 at risk. About 20% see the chronically ill as at risk. 14% people who are 2 to 5. These next two are really fascinating to me. Only 2% of the French see workers who are exposed to heat. So think asphalt workers, pavers, roofers, and so on. Only 2% of the French see them as at risk. And they are the sentinel cases. In every major heat disaster, they're the first ones to die. They're the first ones to be hospitalized. When the pavers start coming in the hospital, prepare beds for older people who are going to come in the next couple of years. Right? They are always the sentinel cases. And only 1% see pregnant people or people who are living in precarious situations or people who are living in isolation as at risk. And I think we've already kind of demonstrated that isolation is one of the biggest risk factors. So there's a real kind of disjuncture between what people think and what's actually happening, right, outside of that. I'm going to skip the next slide for the interest of time, but I do want to point out just a couple of figures. Nearly 20% of people who are 65 and older don't know that you can drink water to avoid dehydration. That's a problem, right? And then down here, some good news, right? Nearly 60% of people who are 65 and older reported that they've been visited by family during extreme heat events. So people got the message of what happened in 2003, that these are preventable deaths, that you need to check in with your older and more vulnerable neighbors or family. But only 4% report having registered with those municipal telephone networks. Okay, 4%, that's not 4% of the population, it's 4% of people 65. So these are people who are definitively at significant risk, who simply do not see themselves as at risk. So what's happened with extreme heat events? Neil and Tabaldi wrote in Science in 2004 this really famous piece that basically titled says it all, right? We are going to see more intense, more frequent, and longer-lasting heat waves in the 20th century, or 21st century, excuse me. So let's define a couple of key sort of concepts here. Duration. So in France, a heat wave has to be 3 full days long before it's called a heat wave. Otherwise, it's just a high temperature. Okay? You have onset, then you have 3 days, and then it goes away. Okay, so it's 3 days in the middle. So you're not counting the first and last day. Severity is the difference between average and observed temperatures, and so there's a degree of magnitude, right? And you might establish a threshold depending on where you are for how many degrees centigrade that is. And intensity is the cumulative value of all the severity over this defined threshold for the event. Okay, with me? Okay. Now, there are excellent data that show the world is indeed getting hotter. Right? This is the 1940s, and this is the 2000s, and this is 2023, which is the hottest year on record as measured by surface air temperatures. So good data to suggest that the world is very much getting hotter. And as temps rise, so too, in France at least, has all-cause mortality. So in the past 15 years, we see that deaths have tended to rise annually. There are a couple of dips here and there. But in 2007 with about 520,000 people dying, again, this is all-cause mortality. In 2020, 650,000, right? That's a pretty big jump. 2020, obviously, this is overdetermined by COVID-19. Okay, and of course, baby boomers are now reaching the age where they're starting to die in fairly significant numbers. So there are a couple of factors that exist outside of heat to explain why this is happening. But thought it important to share the big picture. But a study by a team led by Mathilde Pascal, who heads the Environmental Health Division at Santé Publique France, notes dramatic increases in heat waves in the late 20th and early 21st centuries. Okay, this is a complicated table to read. I'm going to explain it in really simple terms. the critical number here is the number of departmental heat waves. So what is that? Basically, when an individual department declares a heat wave. So it could be the same heat wave, right? You could, if you have a national heat wave, that would translate into 72 departmental heat waves. Does that make sense? Okay? Like how we count student credit hours here, right? Essentially. And I want you to just note the increase, right? So let's take this first decade, 166, between 74 and 83. It doubles, right, when we get to 2004 to 2015. Also, take a look at what's happened in just 3 years, 2014 to 2016, 187. That's going to be more than 600 if that trend continues for the rest of the decade, or nearly 600 anyway. And that's basically a quadrupling of what you're seeing earlier in the 20th century. So that's, something's happening here, right? Heat waves are going up in a huge way. And mortality is tracking it, right? These heat waves have brought with them consistent excess deaths, particularly among older French people. I've got just kind of a summary. So these aren't departmental heat waves. These are heat waves that are documented in the country, not by region or department. But basically in 2015, you've got 3 significant heat waves that kill about 3,000 people. I'm not going to go year by year, but I do want to stop at 2022, where there are 3 major heat waves and 11,000 excess deaths. Okay? So we're back in 2003 territory. Now, not all of those are necessarily heat deaths, because there's obviously the pandemic complicating things. But I do want to kind of unpack this a little bit. First of all, it isn't just a French story. There are rising deaths attributed to heat across Europe. Since 2000, an average of 20,000 people per year are dying preventable heat-related deaths in the continent. And as I argued in the Washington Post op-ed in 2019, these successive summers of extreme heat are calling the entire notion of excess death into question. When we measure excess death by comparing it to the average numbers of deaths in preceding summers, what do we do when those deaths are happening every year? When every year has excess death, how do we find a reference point, right? These numbers are baked into background mortality, and so what that means is that excess death is becoming less and less visible. I'm going to break that down in this next slide. So as heat deaths increase every year, the point of reference also increases, right? Remember how I said they did it in 2003? They measured it against the 3 preceding years, right? If those 3 preceding years also had a lot of heat deaths, then how do you differentiate? So this renders those excess deaths invisible as they become part of the point of reference. And also, importantly, focusing on heat waves, and this is extreme heat deaths that happen outside of defined heat waves. So remember when I said those are those 3-day periods at least, right? There are a lot of hot days that aren't in those 3-day periods. And they're also correlated with higher mortality. It also doesn't disentangle other deaths, like COVID-19. Remember when I said that you can measure excess death in the absence of an epidemic of cholera? Well, we don't have an epidemic of cholera, we have an epidemic of COVID, right? So there's a study that came out last year from Mathilde Pascal and her team again, estimating the proportion of mortality that you can attribute to exposure of the general population to heat in metropolitan France. That's a really catchy title, but it says it all, right? And so this is a project that's designed to measure what the effects of extreme heat have been from 2014 to 2022. And there are some really fascinating findings here. So one of the things they look at are heat deaths outside of heat waves. And what they discovered is that from 2014 to 2022, they're estimating 32,000 deaths total that are happening between the 1st of June and the 15th of September. But only, 23,000 of those are happening in people 75 and over. But only 28% of them are happening during the heat wave as defined by the Planck Q. The rest are happening on just really hot days. So in 2022, they're counting about 7,000 excess deaths, where the total number is 11,000, but they're calling 4,000 of them probably related to COVID. 29% of them are happening during heat waves. And so 70% are happening outside of heat waves. And something similar in 2019, right? So what this study tells us is, that exposure to hot water below the heat alert threshold or above that threshold but for fewer than 3 days brings mortality risk. And temperatures that correspond with this lower risk but frequently occurring kind of temperature have a higher impact than extreme events. So we maybe are focusing on the wrong thing, right? The impact is that this means that elevated heat mortality is happening outside of these defined events, and that means that these deaths are happening throughout the summer, and they're happening invisibly, okay? And that means we're rendering excess death calculations even more difficult because they're happening all summer long. So Pascal proposes a new model that's going to quantify mortality that you can attribute to heat in summers using historical temperature and mortality data by department. So for each department, they're taking an average temperature from a reference weather station, and then they're taking total mortality as recorded by the Census Bureau. And then they're accounting for seasonality and long-term trends here, but what you're doing is essentially looking for correlations between high temperatures and elevated mortality, okay? But not necessarily doing an excess death measurement, right? You're just looking at total mortality and you're looking at high temps and you're seeing where they overlay each other. Because excess mortality measurements don't work. There's a big limitation. Historical data suggests that temperatures and mortality aren't absolutely related. So if you look at 2003, temperatures were higher in Marseille than they were in Paris during the 2003 heat wave. Paris experiences 3 times the normal death rate. Marseille has an elevation of only 25%. Okay, so people survived like crazy in Marseille, and they died like crazy in Paris. So it's not just about temperatures. People in Marseille also, they have hot summers all the time. They know how to deal with heat. They build for it, right? They socialize knowing how that you need to get out of your apartment, right? So there are social factors that explain this. But temperature is just one factor, right? It's a clear, measurable factor, but it's only one factor. Just a couple of more slides. I promise I'm getting to the end. There's something similar that's happening with COVID-19. As fewer and fewer tests are reported, fewer deaths are counted, the pandemic is becoming less and less visible over time, right? Any of us who might test ourselves at home, are you calling your doctor? Are you calling the state public health agency or the Dane County Public Health and reporting that positive testing? I think a tiny fraction of positive tests are actually being counted, right? And fewer death certificates are probably attributing a death primarily to COVID. So these deaths are becoming less and less visible. And in an era of changing climate, of course, the pandemic points to overlapping vulnerabilities of those who are at risk for COVID complications and heat death, right? So essentially, older people, people with comorbidities, people with mental illness and addiction, these are the people who are at the highest risk of dying from either of these things. Right? But preventing death from either conflicts with the other. Right? So what do you do to prevent COVID? You hole up in your apartment. Right? What do you do to prevent dying from a heat wave? You go out to a public place and you go into a store or a movie theater to cool down where there's air conditioning. Right? And this is exactly what they tell you not to do. And there's high rate of infection. So yeah, there are some critical issues here. So I'm going to skip that for a moment. Okay. So I wrote an op-ed last summer about this that came out in USA Today. COVID mortality is in many ways masking the severity of extreme heat. It's at the very least muddying what's happening in extreme heat. So if you look at this study that came out in Nature Medicine last year, it notes that 2022 was the hottest summer on record in Europe. It documents 61,000 heat-related deaths across Europe. Okay, more than that. Okay, so that's really significant. We're getting back to the 70,000 who died in the summer of 2003. Right? But I would argue that the reality is actually far worse because there's no control for COVID-19 mortality, meaning that this 61,000 is below the figure. Let me explain. COVID-19 mortality slows but doesn't stop in 2022. So how many of those 61,000 are dying from COVID-19 and not? We'll never know. Okay? But there's also an indirect impact on mortality. Overburdened health systems are facing 2 crises. You've got people who might be suffering from heat stress, but they're not going to go to the hospital because they're afraid they're going to get COVID. So there are ways in which the two are really complicating each other. But most important, Pascal's report from 2023 says explicitly, before summer, the pandemic had likely reduced the number of people who were highly vulnerable to heat to the extent of concealing the elevation of risk. And this is the critical, this is the point, the whole point of the talk in a lot of ways. Before the summer of 2022, 2 million Europeans had died from COVID-19. 2 million. If they hadn't, how many vulnerable people would have died from heat in 2022? You can only die once, right? People had already been taken out of the pool of the vulnerable, and that produces 61,000 deaths. I think we would have been way over 70,000 had, in the absence of the COVID pandemic, striking down so many vulnerable people. So just a couple of concluding thoughts before saying thank you. 2003 does a couple of things. It really raises awareness. It signals the risk of extreme heat in an era of changing climate. It's a complete game changer on awareness of the risks of climate change in Europe. I remember the French ambassador came and gave a talk on campus in 2004, and he said that his top priority was combating climate change because of what happened in France. Right? This was not a hypothetical Pacific island that we only imagine disappearing, right? And nobody really knows anybody who lives there. This is a global center, in a kind of critical industrial city, so it's a game changer in that respect. It does bring in this whole new wave of approaches to extreme heat as a deadly threat, with these alert thresholds, these action plans, and so on. But really, rapid climate change and these successive deadly heat waves, the kind of normalization of this excess mortality renders these efforts futile because it highlights these real cracks in the model of this critical public health tool of how we measure death or the impact of a disaster. And then finally, COVID-19 points to a difficulty I think we're increasingly going to face, which is managing multiple crises at once in a world completely out of balance. With that, thank you very much, and also thanks to the BCR's office for a research forward grant that made this possible.
Great, thanks very much, Rick.
Of course.
This was a wonderful talk. Do we have any questions from the audience, and perhaps some questions online? Well, I'll start off with then. Well, so thank you again, appreciate that. So first maybe about the 2003. Perhaps this is something I should know, but why was France, and maybe particularly Paris? I guess you got to that, but why was France hit particularly hard? Was the epicenter of the actual heat wave over France? And I'm trying to remember some of those maps that I've seen.
Sure.
As opposed to some of the neighboring countries.
So no, it wasn't particularly concentrated on France. There are a whole range of factors that predisposed France to extreme risk. But it's important to point out, France wasn't the hardest hit. Spain had, I think, just over 15,000 deaths, if I remember correctly. Italy had about 20,000 deaths. Okay? And France has about 15,000. So it fares actually better than some of its neighbors. Right? The temperatures in the UK hit 100 Fahrenheit for the first time in recorded history too. So it was a pretty widespread event. In France, it becomes a political crisis because the French were open and transparent about the numbers right away, whereas the Spanish and Italians kind of swept it under the rug. It was only 2 years later that the numbers came out, and everybody had kind of forgotten about it by then. Yeah. So it made like a brief ripple in the press, but then it kind of went away. Yeah. But France right away digs into these hearings in the National Assembly and the Senate. So it was a crisis there in a way it wasn't a crisis elsewhere because it was a political crisis. People lose their jobs and so on. There are a variety of social factors that really made this particularly pronounced in France. There are these architectural styles, and that's one thing, but also there's a kind of perfect storm. So the heat wave hits on August 2nd. Okay? That coincides with the day everybody leaves to go on vacation. And so that means people simply weren't there to check on their relatives, and that actually became the big story, right? You've got these selfish vacationers who are abandoning their older, poor relatives to die horrible deaths. Actually wasn't really true. Most people who died didn't have family, they didn't have social connections. So that was a story that politicians love to play up to kind of attack a culture of entitlement. But it wasn't really true. Believe it or not, politicians messed with the truth.
Shifted the blame.
Yeah. But it did mean that lots of doctors were on vacation, lots of nurses were on vacation, hospital wards were closed because of this. Lots of private physicians, like doctors you would call out the street as opposed to in the hospital, they were on vacation. The other thing that happens is that nobody who was in charge of anything was around. So I got access to, this is the cool thing about doing 21st century history. Without even leaving my desk in Madison, I was able to find the discovery documents from the hearings in the Senate. And that included every single email that went in and out of the Ministry of Health in the whole period, right? And so it was like, this archive of like 600 emails to go through. And one of the things that happens is like the head of the ministry is out on vacation. And then his second in charge leaves like 3 days into the heat wave. And nobody knows who to email. You're seeing emails bouncing around from person to person. So it was the night about a week in, it's on the Friday night, it starts on the Sunday, it's on the Friday night, that there's a message that basically says nothing of note. No, everything's fine, we're all good for the weekend. And at that point, like 7,500 people had already died. But nobody knew. Nobody was communicating, right? And it was that was the Friday message. On Sunday, the head of the Emergency Physicians Union in Paris, comes out on the news and it's like, we are being buried here. So it just took a while to notice, right? And it's not the fact that nobody was around.
It's never one single fact, right?
Right. Yeah, it's a bunch of things. Dana.
Thanks so much. This was a really fantastic talk. I was thinking a bit about, in 2018, the Paradise Valley fires in Northern California, and one of the things that I think encouraged people to sort of get involved in the Bay Area where I was living at the time is that the kind of visibility of unhoused people who are living in tenements around the Bay Area, so there were efforts to distribute masks and distribute water, because it was so smoky in the aftermath of that fire. But it was, I think, in part because those unhoused people were in really visible places, like living near bridges or living near parks, that people knew that they were there and therefore could access them to distribute resources. And so I thought it was really interesting when you were showing the picture of the servants' quarters, how this kind of immense wealth was really being juxtaposed by this kind of extreme poverty all in this really closed kind of space. And so I wondered if there was something about that experience that rendered the experience of some of these 100 people that you trace in the book kind of less visible in this story. And I guess my question is about kind of the role of the invisibility of poverty in kind of urban spaces and how that shapes the response by politicians or by the press or other people kind of in the aftermath of 2003.
Yeah, absolutely. So in that number of 100 people whose cases I traced, you would have expected a lot of unhoused people, right? Because they're going to be people without resources who are going to be buried at public expense in any event, and maybe likelier to live in isolation or at least away from people who have the means to take care of them. Actually, there were only a handful, like single digits, right? One who, this kind of really tragic irony, died in front of a store that sells frozen food. So he died in front of the coldest place in the city, right? But really, it was like 4 or 6 or something, right? So, yeah, I wonder if people were likelier to offer a bottle of water or something like that to someone they could see on the street. That's certainly possible. Unhoused people are also less likely to die from heat because they're outside where it's cooler. If it's 100 degrees outside, it's 130 in most apartments, right? Because there's no air conditioning. And when I lived there, when I was doing my field work, I actually bought a portable air conditioner. And the first thing the person in the store said to me was like, "You don't live under the roofs, do you? Because it won't work out. It won't be powerful enough." But yeah, I think this invisibility factor is really critical. I can just say anecdotally, having lived for long stretches in Paris in apartment buildings, you know there are people there, but you never see them. Right? Very occasionally you'll see somebody come down the steps and, you know, go out. The only reason I knew the ones when I was doing the field work here, there were 2 of these in our building, and the only reason I knew the people who lived there was one was a DJ who would crank music at all hours of the day and wake my kid up when he was 1, and that's not good, right? He was really nice that he would always turn it down. And then there was an older Russian man, and we knew he lived there because he would constantly beat his partner, and that made a lot of noise and created a lot of trouble. But other than that, you know, you just wouldn't even know that anybody's there. And I've lived in buildings where, you know, I know that there are probably older people living up there, but I never saw them. And so the invisibility factor is critical, especially because the people who are most at risk are the people who are never leaving their apartments because they can't. Right? It's a disability. Yes?
I'm curious about elderly people living alone, and you had in the servants' quarters, and also in the high-rise banlieues outside the city. How many of those apartments have actual telephones in 2003?
Yeah, it's a really good question. I don't know. I'm sure I could find that somehow.
So, you know, if you don't have a telephone
Right.
or a cell phone these days,
Yeah.
telephone networks aren't going to do you any good.
Exactly, right. And that might be why so few vulnerable people are signing up for them, but they also may not be hearing about them because they don't have a TV either, right?
Right.
And so, yeah, I think relatively few. So the first thing I tried when I was trying to figure out how to approach this project is I went to the cemetery where all these people were buried, and they were conveniently put in just these 2 sections of the cemetery. Right? So it was very easy. I just looked for death dates in August 2003 and was able to identify all of them. Right? So that was simple. And then I had to find them. Right? So I went to the Bioethics, the National Library, and got a phone book from 2002. And tried to find their addresses, and struck out in a lot of cases, meaning a lot of these people simply didn't have phones, right? And then that also was really flawed. So there was this one woman, her name was Suzanne Henri, pretty common name for them, and so I had to figure out which one to visit, right? And a kind of funny story, I went to the first address I went to, and said, yeah, I'm here to, you know, can you tell me about your neighbor, Suzanne Henri? She died during the heat wave, and I said, oh, yeah, I guess she did die during the heat wave. Didn't she? Yeah, she was older, and it told me the whole story, right? This whole big, long narrative of how she was living alone and how, you know, told me exactly what I wanted to hear. And then finally, when I started going about this another way, I wrote to vital statistics offices and got people's actual kind of documentation of when they died. Turns out this woman died in October. She didn't die of the heat at all, right? And that story is in the book because it was such a failure of ethnography, but also it kind of confirmed the bias that anybody would believe that somebody older would die during the heat. Right? I had to feed her very little information to get back exactly what I wanted to. But yes, so the phone book routine did not work. But getting these these notices from the Vital Statistics Office was great. They contained purely demographic information. Such and such was married, or they were divorced, or they were born to these parents in Normandy, and then they arrived in Paris on this date and established residency here, and they died on this day. The death was noted at their home by a police officer, or they died at the hospital, but they lived at this address. Lots of really good intel came out of those documents.
I'll ask one more follow-on question to the previous one. We won't keep you too long, but I'm wondering if there's an unintended consequence of a policy in that maybe France has been doing better than other countries in terms of providing shelter for their impoverished part of the population, right? Maybe not, but they're less visible, but they also are not homeless. Is that I mean, I don't know how far I can stretch it, but if there are opportunities for the poor to be living somewhere inside, you know, having to pay very low rent or something, it's bad in the heat wave. But in other circumstances, right, that might be seen as a favorable policy from a French perspective as opposed to living under the bridge.
Sure.
right? And so the unintended consequence is, well, these are actually, I won't say death traps, but
Yeah.
but in a heat wave, they might be. I don't know if there's truth
Yeah.
to that or not.
It's hard to say. I mean, this is something this has been going on since the early 20th century, right? And so this is an ongoing housing issue.
Yeah.
There are really critical safety issues, right, where people simply cannot get out,
Yeah.
right?
Well, yeah,
Because
you
they
showed the
are,
stereotype.
and then real kind of hygiene issues too, because people are they're gonna have to struggle to get to the toilet.
Yeah.
Right? Actually, Simone de Beauvoir, the philosopher, wrote about this in the 60s. It's already a significant problem. And writing about how they say that the staircase is the enemy of the elderly. Right? And she actually talks about a case of a woman who lived in one of these kinds of apartments who had to go up a flight of stairs, across a long hallway, down another flight of stairs to access a toilet. And so that's 2 staircases four staircases, right? Each time, that's a broken hip waiting to happen. Right? Or just a feat of strength and endurance. So it's hard to say. I mean, I take your point. These are spaces that are really problematic. Most of them are rented on the gray market too. They're documented spaces. The city knows they exist, but there's a lot of under-the-table renting happening. My wife and I looked at an apartment when we were there just for fun, like go to a house, like not that we were serious about it, but it was in this really cool building across the road, and we were like, let's go check it out. And the realtor said, oh yes, it's a 4th floor apartment, but it comes to a place on the 7th floor too, one of these, little servants' quarters. And you can totally rent that out on the slide and help cover your rent out here. So it's a known practice. There are basically 3 populations who live in these spaces. Right? There are students. I'm not too worried about students. Inequality is a very big deal in France and in the U.S. So I'm not saying students don't have issues, but they tend not to have the same mobility issues, right? And so they can get out of the street. Undocumented migrants, and that's a whole crisis in its own right, but they tend not to live alone, tend to live with someone else. That raises other issues in these tight spaces of living with 3 people, but heat risk is not an issue because somebody's going to notice if you collapse, right? And then the older poor who have aged in place, and that's really huge.
Any questions online or any other follow-up questions?